we can motivate young doctors as well as paramedical people to go to rural areas. We've heard several times in this morning that 75% of the population lives in rural areas, but 75% of the doctors practice in urban areas. The British tried it and failed. Government after government after government, the minister has left so I can also talk. Minister after minister, government after minister, government tried and they've all failed. Okay? How do you motivate, given that there are challenges in the rural areas, how do we motivate? I think some answers already given by like posting the postgraduates and so on. But how do you think, if you were the Minister of Health and you were given this, how will you solve this problem of getting paramedicals, doctors? Abdul Kalam said the concept of Pura, providing urban amenities in rural areas. That's exactly what you're talking about. How do we crack that?
I'll start with, hello. I might start with the humble request to the All India President. There must be a conference of all medical college principals, managements, and the Medical Council of India. That would be the right step to motivate the people in a campus like this. Next thing I like to focus the attention here is national health policy. Till today, I do not know how many medical people know it. And it's the medical students will have to know what is the national health policy. Health and happiness are the prime drivers of economic growth. It is its very purpose. That's what the health policy says. If that is so, the students is not that they come to rural after MBBS or after MD, after MCH. Right from the first year of medicine, they will have to visit the villages. Medical Council will have to make them socially conscious and sensitized to the rural people and understand that, I might say just a small thing, I am basically a pathologist. Swami said, what is pathology? I said, Swami, Roga Nirdharana Shastram. Bangaru, Roga Nirdharana Kadu, Nivarana Kavali Prapanchaniki. Nivarana is the one that medical students will have to be told. You may ask if the students are asked to come right from first year to village, what they do. They can do on counseling, they can do on nutrition, they can do on awareness, they can do on immunization, they can do everything. That is the best way to motivate the students. It is not that after MBBS. This is what I have observed right from All India Institute to the Nizam's Institute. And the last but not the least, when the medicine has to be told, it's really sad. I told on one of the televisions also. It's very sad. I asked as a rector, why did you choose medicine? Nearly 150 medical students I interviewed and asked them. You know, everybody said, except one. Everybody said, to serve the humanity. What a paradox, what an irony, what an antithesis. What is this? Only one student said. Shall I tell you honestly, sir? I said, be honest and tell me. Doctors make hell of money. This is the focus. When you have got 70% of the medical colleges outside the public sector and each medical seat is costing 45 to 50 lakhs, what do you expect the parents of the children to ask them to go to villages? This is really a sad state. If we make socially conscious a student, today I want to see an orientation course at the first year level, taking them to village. These are the people who need medicine. First year nobody is going. Second year, only in the final year or in the house urgency, just it is a picnic to visit a village. This has to change. If you want to motivate leaders, doctors, with the permission of Mohan, I'll just go with one word. I wish the health ministry is here. My humble request is, we are giving so many licenses to the private, whatever you may call, medical college or nursing homes, corporate hospital. Can't they adopt one village to regularly feed with their own doctors? Why do you give license to a medical college or give it to that of a private hospital or a corporate hospital who do not care for their own people? This is my humble appeal. Make a legislation that every private hospital, corporate hospital should adopt 1 to 2 villages based on their bed strength and the doctors go cycle. They also feel they are serving and come back to the hospital. That is a wonderful opportunity. I wish if these 3 steps are taken, Medical Council can start visiting rural areas right from first year. Thank you very much.
There's not a single state in this country, the poorest of the states, if you take, they're dying due to non-communicable disease. They've already overtaken. More than 50, 60, 65% of all deaths are due to non-communicable disease. Under non-communicable disease, unfortunately, cancers are spreading like wildfire. I don't know the cause. But if you were looking at it not from a corporate point of view, but looking at it from a public health point of view, let us say Sathya Sai Seva organization wanted to reach out. What are the cancers which are so easily detectable, treatable, and where we can use other people? Don't even need doctors. We don't want a cancer specialist in every village. It's not going to happen. So can we train nurses? Can we train our ASHA workers? Can we train others? And which are the, let's say, 5 or 6 cancers that you can easily pick up and do something about?
So, Om Shri Sairam. I think I'll go back to the very basics of what Swami's vision was. I think we discussed here about how can we get the patients to the hospital and give it free care to them. We discussed about how we can go and search for patients. We also very slightly touched upon how can we go and actually give health to the patients so that they don't become patients. And that was Swami's vision. He always used to say that an ideal society should have less hospitals, less illnesses, and less doctors. Then you call it as a healthy society. Today we've made a society that talks about only medical care but not health care. Health care is only the larger picture of it where we are imparting health. If you look at the WHO statistics today, they say the estimated cancer rates is going to be 1 in 3 by 2025. Which means 1 in 3 of us is going to probably have to choose how we are going to die. It is going to be diabetes, hypertension, cancer. These are going to come in front of us. We have to face this reality. Now, if you look at the entire statistics of cancer, 75% of these cancers are preventable. 75. If you look at it, and I work very closely with the WHO to work on preventive initiatives through Swami's grace. Tobacco, alcohol, diet, nutrition. 4 things. Let's take them head on. Now, I work very closely with the government of Karnataka, with the Honorable Minister. I'm a member of the high-powered committee there. I report to the assembly, and I spoke on one of the assembly meetings and I asked them, sir, what is the point in having a BPL scheme where you're going to innovate illnesses, sell illnesses, tobacco, alcohol, all these things, and then after that say we will build another hospital, we will build a BPL scheme for poor patients because we care for them, we will give 1.5 lakhs per patient or per family free. Absolutely pointless. The answer lies in prevention, and I think that is it. The answer lies in seeing that we are going to have a healthy society, because no amount of hospitals, whether it's corporate, private, government, can cater to this problem. This is going to rise immensely. So I think the answer would be tobacco control, alcohol control, and diet. Diet is going to be the new smoking of this generation, because every single packaged food is going to have preservatives.
Probably add physical inactivity as well.
Yeah, absolutely. And nutrition, because diet does not mean nutrition. So I think you may very well agree with me, sir, that diet is not nutrition. We are eating half of the junk food, which is all got preservatives, chemicals, adulterants. The body does not need all those, and that is where every single cell has got a desire like us to grow faster, to grow more. I always say we are currently living in the era of instant, more, and unlimited. We want buy one, get 3 free. We want unlimited coffee, unlimited this, unlimited that. We want each and everything we want is more. We go for more buffets rather than limited food. So the natural tendency of the mindset is become cancerous already. The mindset has become the body is eventually going to get it. And that is where mind, body, soul medicine will also play an immense role in preventive initiatives. And I would like to close by one more point saying, in addition to tobacco and alcohol, when I spoke about alcohol, my own perspective in the Swami's villages, where we worked with patients in Bovipalya, Tarapanahalli, Madapanahalli, and other villages, was something very astonishing. And Swami has often directed this in through our visions. Very, very stark was, and this is one of the arguments I placed in front of the assembly, let us assume that alcohol does not have health harms. I said, let's assume. Because we banned gutka, and that's when one of the assembly discussions was we should reverse the ban. And they said alcohol bans don't work, and Andhra was given as an example. So I told them a simple example. I said, see sir, bans work. And I give him another example. Let us assume alcohol does not have health harms. Now, I'll give you one very simple example. When N.T. Ramarao's government banned alcohol, one of the most beautiful things that happened in the studies, and I'm going to take 30 seconds to tell this, was something very beautiful. Can anyone of you imagine what was the most significant impact when alcohol was banned in in Andhra at that time?
Domestic violence came down.
Women opened bank accounts. Shri Shakti groups were dismantled. Jivika groups were dismantled. Women started living with dignity. The societal balance improved. Men, instead of standing at 5 a.m. in the morning in the alcohol shop, started going home. They were starting to eat dinner together. Rapes of their own children reduced in the houses. There was so much of beauty. I told them, if you really want to take up head, let us take it head on. Let us take all this head on. And that is where I think as doctors, as a message for me is, all of us should work with governments. We have to work to tell them, because no amount of policies will change unless we stand loudly together and talk to them saying that prevention is the answer. And that's where we all have to come together. Sairam.
Thank you, Dr. Mohan. Thank you, Nimesh Uncle. I have to call you that. As a Balvikas student, I have learned to speak and spoken at various elocution competitions from Dharmakshetra, taught by Kamala Auntie and Nimesh Uncle from when I was maybe 5 or 6. So a true product. I didn't know that one day I'd have to speak here, and in service of Swami. So very, very grateful to be here, first of all. I'll also make a quick statement. The Honorable Minister for Health and Family Welfare, Mr. Nadda, had accepted and was going to be here today as well. Unfortunately, we've had a lot of changes and a lot of different things happening, so he conveys his warmest greetings to the conference and would have definitely been here and is extremely thrilled to see the great gathering that there is. I want to make one quick statement before I answer, and I will answer those questions. If we could just take Dr. Narasimhan and maybe clone him and put him in the 700 districts with his mobile medical hospitals, I think I could retire, we could all retire, and we would all go away, and we would not need to do anything at all. I mean, it is such a brilliant presentation. I really do hope that we can, we will get a copy of it. And I really, Nimish Uncle, I'd love to see if we could maybe have a presentation of that done at the center. Because we really, this is the aim of universal healthcare. This is exactly what we need. And exactly like he said, you can have one brilliant model. How do you take it and scale it? And we are not one country. We are 36 plus countries. We have such different challenges in epidemiology, in population, in culture, in socio-economic demographics. Everything is so different that you cannot have a one-size-fits-all. So how do you therefore modify? So lots of work to be done. Answer to your question, I have to come back to that idea of greed. And one of the reasons what is going on right now, I know there are a lot of ex-deans, etc. We are in the middle of massive medical admissions right now. I'm sure all of the doctors in this room are aware. Tomorrow, our second round of admissions close, and then we have the final admissions. My team is actually working round the clock, and I'm heading back right after this because we're in the middle of it. Medical corruption is a 20,000 crore industry in this country. 20,000 crores. I mean, it's a figure. We've actually had some, back of the envelope research done on this, because the amount of corruption in medical education today makes you just want to only go down and, the only thing you can do is pray, because this is not, I don't know how you sort of go in and intervene. Clearly, there is a lot of issues going on. But part of the reasons why you don't see policy change, why you don't see the amount of, quick policies towards pro-population that you see, is precisely the answer, I think, that Dr. Saab, you were talking about earlier. Only one student says that he's in here to make money. But the truth is, every one of them, it's an investment. They have to make sure that they get it back. There are students studying medicine because they have to either get it back through their patients, or they better marry some pretty, beautiful women and get it in their dowry. There's only one answer, because otherwise you're not getting the money back. So what's the answer? It has literally become a way for you to get a tag and go out there and then, get the investment back. And so the number of unnecessary diagnostic tests and treatments in this country. There was a very close friend of mine who's an ophthalmic surgeon who started this company called MediAngels. And they did a back-of-the-envelope study and found that 60 to 65% of all tests and treatments done, particularly in urban areas, are all unnecessary. My driver, who makes 10,000 rupees, his father gets simply told to go put a pacemaker. Because he came in there, dil ka daura pad gaya, pacemaker dal do. Where on earth is this guy going to go for 2.5, 3 lakh rupees? And this is the crux of the problem. And in our attempt to, when we go about, and I'm not speaking, partly I'm speaking as government, but partly I'm also speaking as, one of the people who's serving here to serve. It is very critical that in our core policies, we become pro-population and not pro-private sector. And that's a big threat that we are under. One of the reasons why the government cut the budget initially, Dr. Mohan, to answer your question, is we were trying to figure out, India is the only country probably of this level of economic development where we have 85% of the care in this country that's only privately provided. Less than 1%, now the 1% has become close to 2% of our GDP actually goes into public health, which is a shame. It's actually a national shame. We are slowly fixing it because we realize it. So the only answer for us as government is to go into private sector and hold them accountable, because you cannot shut down 85%. We are not going to be able to take the 85% and close them down. But like I mean, you've done the most fantastic training of diabetes educators across the country. I know this from my prior life. We need training and human resource development more than anything else in this country, and which is why we've just launched an initiative called the Skill for Life, Save a Life initiative. Core skills, even in the doctors. I mean, these doctors are different because they are here as Swami's doctors. But if you look at an average MBBS today, I guarantee you, he or she will not be able to distinguish their right leg from their left leg because of the quality of medical education being imparted in the private colleges. And that's a massive challenge. And we cannot have, so just because we have, we claim we have so many doctors, we have so many nurses. No, we do not. Because the true skilled population of health workforce that we have in this country is abysmal and not at all enough to provide the healthcare to the rural doorstep that we are talking about. So among all the various health systems, the WHO talks about the 6 health system pillars. We have built 12 aims. Well, there is nobody in the aims other than our Delhi aims, because there are no people there that can actually service people, can take care of people. Our core need at this point, which is why there is so much focus, Dr. Mohan and everybody, is on skilling, on skill development for health, and on workforce development for health, and policies towards making sure that we have regulated workers in the system. One of the bills that I have just finished, we've drafted it and the law minister has approved, is a bill for in fact, I think we have a lot of paramedics in the room here today. We've drafted the bill called the Allied and Healthcare Professional Bill, which is going to be brought into cabinet. It will actually regulate and put in place a license for every other than doctors and nurses, every radiographer, every vision technologist, every diabetes educator, every other provider will have some set of skills and some set of licenses so that they can go in there with skills. So skilling is going to be a huge issue, and competency building is a huge issue. The only reason government has not put in as much effort into sort of currently going away into really going into more government spends is because like I said, the answer, we have such a huge private sector already. Unless we get in there and regulate that quality, we are not going to, we're only going to be throwing more money in the system. The utilization of the money, the monitoring of that money needs a lot more work. And so skill building, skill development, and people development and policy is really our focus at this point. Thanks.
Sorry, this hospital.
Yeah, point taken. I think we should be all inclusive, and
Yes.
as many stakeholders you bring in, faith-based organizations, you can bring, if you go to
Good.
a temple, to a mosque, to church, to anywhere, as collaborators, each one will take up the responsibility. Point taken, sir. Here.
Yes.
Yes, madam. You need a mic.
Now, preservatives in food items.
Private sector that is, I think, worth 300,000 crore. I don't know how many crores it is currently worth right now. It is very, very vital. Today, in the UNIDO report, if you read, India stands among the top 5 export rejects to the world in food. That means that the best quality food that is exported is actually reject, which means you can imagine what we would be consuming locally. So there is a definite need for all of us to raise our voice to this level and start talking to the government saying, please regulate food preservatives, make it more safer. And that's the only way possible. And that is one. And the second thing is we start eating more healthy food, not packeted food, but more fresh and healthy food. And that education at the local level.
Stamps. I think as I think Ms. Kavita said, Sister Kavita said, I think the whole thing comes down to corruption. If that little bit of corruption we can remove, and if we enforce all that is good for the common good of the people, many of the middle income countries have done that. You go to Brazil, you go to other countries, they put the country first. In India, we put the individual first. So that is one of
Just
the
another
problem.
point, the Insecticide Act of India is of 1967, currently still tabled for changes. So instead of adding 1 ml, they add 10 ml into pesticides because they think more is better. So it's kind of a dangerous trend. I think the government is seriously taking action to regulate all this, and hopefully in the days to come we should. But before that, self-awareness and eat more healthy food. I think that's the option right now.
Thank you so much. I think in the interest of time, I'm going to end with one. You want to say something?
I just had one point. I think the need for awareness. I think your point was a lot of more, there's regulation. I think as doctors, this room is full of the doctors and, allied professionals and nurses, I'm presuming. There is a lot that you can do as well, right? I mean, so for example, every time your patient comes in, so much goes into educating. I mean, unfortunately today we don't get the time, which is why we are saying we need that next level of healthcare providers other than the doctors. For example, Dr. Mohan may not have, 1 hour to give a patient, but a diabetes educator will be able to give a lot of that time and counsel somebody on how to eat. Similarly, you may have a diet assistant, or a dietetic aide who's able to say, these are the foods that you eat, etc. So these are all these new cadres that we are trying to develop, who doctors, in fact, we will need, Nimesh Uncle, the doctors of our group to sort of, put up their hands and say, we would like to coach and teach and develop these people in rural India, because they will then be able to advocate and get the message forward.
Someone asked me to practice Ayurveda, for example. But the Ayurvedic physician also doing allopathy may not be good. But I think each system can reach large numbers of people. So on that note, yes, sir.
Of the patients, but specific ailments, we are not in a position to make it out.
Thank you, sir. Point taken. We are in interest of time. I request some of you who have got excellent ideas.
Days before you to dwell, may not be today, in days to come. Our education is not tuned to rural. It's a high time we design a course which we can call it as a bridge course, not necessarily going for 5 to 6 years. Today, highly developed like United States recognize physician assistants, nursing physicians, they can do lot of good work. Every doctor need not go to the villages. Basic, holistic one can be done by a bridge course, which like something on this, and also family physician. If we do it, perhaps we are addressing the nation. There is no point in number of medical colleges. The quality will be compromised at the same quantity. Because the highly technically oriented today medical education is highly expensive. So we must have bridge courses.
Thank you all.
Our All India President will present the memento. Dr. Rao, Vishal Rao, Dr. K.S. Ratnakar, and Dr. V. Mohan. Those of you who have questions that you want to ask, you can also mail them to info@ssssoindia.org. I repeat, any questions that you intend to ask, you may kindly post them. In case you don't have time to write it down and give it to us, you can always post it at info@ssssoindia.org. We will now move on with the next session.
An American College of Cardiology and FRCP from London, Edinburgh, and Glasgow. He was involved in the over 15,000 open heart surgeries and started the Department of Cardiology at Sathya Sai Medical College, Chennai. He has 80 professional articles, abstracts published in various medical colleges, and founder trustee of Sri Sanskara Heart Foundation. Sathya Sai Organization, Himachal President. State Vice President, Sri Sathya Sai Organization, Himachal Pradesh.
Grass, visiting professor at the Cleveland, Ohio, USA and Hirsch Medical College, USA. He was the first Indian to get the AINA award in American Academy of Neurology meet in 2001. On the social front, he has been conducting free neurology service every Thursday in his clinic. I also take the pleasure of inviting Dr. Anil Kumar Mulpur, who is the Chief Cardiothoracic Surgeon at Sunshine of the Millennium Award. Dr. Anil Kumar Mulpur is one of those Indian doctors who has cleared the FRCS Glasgow as well as Edinburgh.
Post-graduation in medicine and postdoctoral degree in cardiology. At present, he is Director of Cardiology at Institute of Cardiovascular Diseases, Madras Medical Mission, Chennai. Sir, please.
Our next speaker is Dr. M. Arvind, BDA, Radiology, Special Care Dentistry at Savita Dental College, Chennai. He has also been actively involved in the activities of Sathya Sai organization and has been a member of the Sundaram Veda group since 1997. The speaker for this panel is our very own director of Sri Sathya Sai Mobile Hospital.
The doctors are supposed to be very large-hearted. We have very eminent speakers here, and a very big round of applause is needed to such eminent doctors.
In the interest of time, I think we'll get cracking straight away. I'll start with Dr. Murthy. Dr. Murthy, you're not only a cardiologist and a vice chancellor and so on. I know.
I belong to the same batches. In our medical college, government medical colleges are the only source of medical needs. Today, over the last 25 years, the corporate sector has entered, which has caused a lot of criticism. At the same time, the positive aspect of it is the medical care has gone to a higher level of its quality. In the bargain, we have lost the connectivity between the doctor and the patients. The concept of corporate medical care has taken the front line and the public issues have come in, and because of this, there is an issue of dividends. When these things come into the picture, the doctors lose their relevance. We are just pawns, and many times we wonder how to do it. We cannot expect the government alone to be responsible for the healthcare delivery system. With a GDP of 2.5, it's impossible. The healthcare delivery system is not the responsibility of the government alone. It should be the responsibility of the individuals, institutions, and the CSRs together, and the great organizations like Sathya Sai Institute. People are telling that there are no cash counters in Sathya Sai Institute. Nowhere in the world it can happen, and again, never again in the world it will happen. So let us be realistic. We need a balance, we need honest, and in the bargain, we are all responsible, mainly the doctors are responsible for this sort of affair. Today, the trust deficit is causing a lot of embarrassment for the doctors, and we have to reinvent ourselves, rediscipline ourselves, rededicate ourselves. Otherwise, what has happened to BCCI will happen to us. Today, the various government agencies, its Chief Minister's funds and Prime Minister's funds are there to support us, but that alone cannot touch the expensive treatments. It is possible for volunteers, individuals, institutions to come together, join the hands to take the healthcare delivery system. With a 15% GDP of United States is looking at prevention, with a 2.5% GDP, we can never imagine that 1.3 billion can be taken care. It is the responsibility each and every one of us to be a part of it. Then only the healthcare delivery of 2020 will be a reality.
Dr. Sanjay Agarwal, as the director of the Sanjeevani Hospital at Solan in Himachal Pradesh.
And Grace, our state is a very small state, but still, with Swami's grace, nobody begs out there. Means us, 90% of our population stays in the rural areas, 10% in the urban areas. Lack of awareness, a bit of a, we'll say, poverty also, illiteracy, and long traveling distances. That makes healthcare access a bit difficult. In our state, we have tribal areas, difficult tribal areas like Lahol Spiti, Kinnaur, and Chamba-Pangi and Sirmaur, where people, they are very less aware of the medical services being provided by the government. In our state, lot many free medical services like the RSBY, the Mukhyamantri Swasthya Bima Yojana, and other free facilities are being given, offered to all the people out there in our state. They all have access to it, but they don't have knowledge about it. Our organization is entering all the difficult areas, the rural areas, the difficult part of it, the old age people, all have to be made aware of all the services being provided out there, along with the services being provided by the Sri Sathya Sai Seva organization there. The thing which lacks, again, referring to the topic we have in discussion today, is humanizing healthcare. The lack of human touch, that lack of compassion, the lack of empathy, that makes things all the more difficult. But truly speaking, in our state with humans, with Swami's grace, all the doctors, I'll say most of the doctors, they have a human heart. All of us sitting out here, they all have human heart. And we thank Swami for being with us in this medical mission of ours.
Dr. Srinivasan, you're a good friend of mine. I'm going to ask you a very difficult question.
Then the next step, we take the community health care programs and take them to the villages. But what does the society mean? It's a very big word. Society is ourselves. So we thought that I will have the model instead of starting it from the government and then start thinking that others are to be like this, instead of dictation. If each one of us in this particular hall as a doctor choose one day in their program and educate them, that is the final answer for Swami's real love and compassion. Swami used to say this, the awareness of the individual stems from the intellectual process through the mind, and the mind acts through 5 special sensory exterior. We are trying to look at things from the exterior, and we are missing the mind, which is nothing but a web of thoughts in which the first strand of thought is I exist. This mind gets into the awareness, which is ourselves. So I thought, let me just try with awareness, that is the individual at the level of even the urban center, poor people are there. It is always said, memory, pity and beauty are short-lived in life. When you see a calamity, when you see something, your heart bleeds for a second, and within seconds it's forgotten. So if you see the poverty in the urban areas also, I think the individuals can do that. Why I chose the Thursday is, if you look through the origin of the days, Thursday is Thor's day, is the most powerful day, and the valiant son of the God, and it is Dakshinamurti's day. When you do it on a Dakshinamurti's day, and the free food that you give after that, it is supposed to give you the energy to continue for the next. And I don't do that. I have 10 people who are working with me with absolute Sai consciousness. And they do it, and I get the benefit. But it is always said, the cooperative skill of all of them are all Sai devotees. They are all belonging to Bala Vikas. They have come voluntarily to help me, so that there is a team of participation. There is a scene of togetherness. On that day, if I do it, only thing is, as he rightly pointed out, I finished it at 150 people. And that particular day, I stop it, I give 1 month free medicines, free diagnosis. If they are abject poor, definitely they are done. The investigation is also free. Now, I have started this. I hope with Swami's grace by my side, till the last breath of my life, I should continue this free service, free investigation, free advice. With that, the soul comes to a complete stop still.
Sairam, the 85% is in the private sector, so there's no getting away from the private sector. So can the private sector do something about it? Mention is made of 1 free bed. Can you do 1 PTCA free? Can you do 1 angioplasty free? Can you do 1 angiogram free? Does that work at all in private sector? Or it's a no, it's just money in all corporate sphere.
I have made a presentation representing the hospital, Sri Sathya Sai Institute of Higher Medical Sciences at Indian Institute of Management, Ahmedabad. We did a little calculation of our waiting lists. If a patient is added to Sri Sathya Sai Institute of Higher Medical Sciences waiting list today for a valve surgery, can anyone guess how many years or days or months it will take for him to get the call from hospital? Any guess?
2 years.
Dr. Mohan says 2 years. Any other number? 5 years. Oh my God. Any other number? 30 years. The answer is 200 years. So he will get a call after Premasai Avatar's completion. This is a fact. And we did not want to admit and put it on paper that we cannot register. But when you have seen, every day you open the doors at 4 a.m., you have 150 people coming. There is no way our hospitals can cater to national load. And our preamble says our hospitals are open without any respect to caste, color, creed, nationality, and religion. Anybody in the world can come and get operated in our hospitals. It's just not possible. So, Swami himself said, these are role models. Yes, I have opened this hospital and showed, it doesn't mean that I'll be able to wipe it out. Swami can, but he will not, for his own karmic theory. Now, very quickly I found, to my satisfaction, that pediatric cases, tetralogy fallow, which is a blue baby, will have to wait for 10 years in Swami's hospital to get operated. 10 years. Some of them have not answered our hospital letters. Some of them may have died. So luckily, government of Andhra Pradesh, then undivided, now government of Telangana and Andhra Pradesh have got a scheme. Karnataka has a scheme, Maharashtra has a scheme, Kerala has a scheme, Tamil Nadu has a scheme. Unfortunately, Orissa, Chhattisgarh, etc., they don't have a scheme. So these patients, I am able to do 100% free treatment, high-end super specialty care to the patient. So I have to really congratulate governments on this because, in my opinion, since 1947 independence, the one thing which they have been able to do is giving this free, high-end cardiac neuro care, not only cardiac and neuro care, to about 1,000 procedures, they are giving absolutely free. So that is first place where I look to if I cannot, as you say, operate at the corporate cost. The second thing which I want to mention is the NGOs, and I have to place on record the great service which is being done by Heart Valve Bank, which was started directly by Bhagavan, and Brother Ajit Popat has done a lot to generate money by donations from people who are not very rich. They are not Tatas and Birlas. They are just, menial workers, and they are putting apart undisclosed amounts. And Heart Valve Bank has supplied valves to our hospitals, and I have been working very closely. If a patient says, I cannot afford, and I say, I am going to operate on this patient free, thank God, Swami has put me in a place where no management has ever asked me, why and how can you do this free? They have never asked me. Whether it is Narayan Hridayalaya or Sunshine, they said, go ahead. And it can delay up to 6 months or 1 year for them to get money. They are with me. So corporate culture doesn't mean sucking money out, and these managements have stood by my side. I am able to do what I want to do, and I will say this patient cannot afford anything free, Heart Valve Bank will send me the money. It will directly send the money to the hospital. There is no handling of money. So that way, I don't think we should be discouraged by the facts, the national burden of disease. But I have given you the facts. Hospitals which are started by Swami are role models. We have to build, whether it is a mobile hospital or the super specialty hospital. We need a super specialty hospital in every district, if not in every state. Then only we will be able to address at least a large part of our workload. Thank you.
Thank you. I think you've been extremely frank, but I agree with your thoughts based on the discussions today.
And these are islands, unfortunately. They are not the majority. And unless we can make these models, whether you call it the Sathya Sai model, or we call it the Narayana Health model, or you call it the Shankara Netralaya model, or the Arvind model, as replicable with its own strengths and weaknesses, so that the larger majority of the hospitals can perform with the same outcomes which these good hospitals provide. See, ultimately, there's no point saying that I provided free service if your outcomes are not great. So you need to provide that great outcomes with the models which are different in this country. It is interesting that the New England Journal of Medicine, which is the Bible of medicine, this month has quoted the Indian healthcare system to be replicated in the United States. And this is amazing that the costs of many of these things should be learned from India, and especially they've talked about the cardiovascular healthcare system, and they've said that in the US a lot of money is spent on managerial things like Somaraju said, counting the money rather than delivering the service, and your insurance is paying a lot of money for that. At the same breath, we can't forget the Gorakhpur tragedy and say that our healthcare at times is abysmal, and we need to settle issues in these areas. So I think that the first question that you are trying to say is, how can we get to prevention, which is, it's a long drawn out goal. You know, the American health system in cardiovascular medicine spent $6 billion and did not bring down anything. So you may have more money in the system. You may do all your talks on various platforms, but the epidemic just continued. So there's something more that we need to learn. One straight thing we can do is smoking, which I think there is no confusion. You know, nobody in his mind has any problem that gutkha smoking has to be stopped. Physical activity is one of those things which everybody can get to. Number 3 is using low-cost technology. I saw a beautiful pamphlet on telehealth, and I think this is completely underutilized in this country, telehealth. And we need to use this more aggressively for prevention, because you don't need anything. You just need to see a patient from a distance and give a sort of an advice and give a prescription, and a physician assistant or a nurse assistant can deliver the job distally. You don't need to have a physical doctor there. Now, when I've been working with governments, I've worked with the government of Tamil Nadu, we just worked with Telangana and Vijayawada in the heart attack program, and we have a STEMI model which is now going into the National Health Mission mode for replication. But what we found that if you tried to go to a government seva worker at the periphery and give her everything to do, she's not going to manage. She's got to talk about sanitation, she's got to talk about nutrition, she's got to talk about immunization, she has to fill a ledger and to fill other things. So what the private groups need to work with, and I would just simply say, if the Azim Premjis and the Bill Gates of the world are working with the governments, I think every physician in this audience should work with the governments in trying to help them to help either the training, the teaching, or in the delivery of the healthcare in the periphery. So I think prevention is a big goal. It's a big task for us, but I think it needs policy work with privates, models to be replicated, and doctors to work in the community with organizations like Sai and the government to provide adequate prevention.
Thank you. Dr. Murthy, you wanted to say something brief?
And the money spent is a maximum cap of 25,000 rupees and is audited, and they take it back because that money is accounted for Yangshan University in South Korea. The other one is the Shastra University at Tanjavur. They are associated with us, and they do the medical preventive and healthcare for the Tanjavur, Kumbakonam and other districts. And those are all again, they spend, we conduct the camps, and these patients are followed up and taken forward. So also some more temples like in and around Chennai, all of them together contribute almost 3 crore rupees annually, which works out, but it is properly audited and accounted. And many of the times, this money is spent for the patients from the northeast of India because they come to Chennai and they don't have what we have, the Chief Minister's Fund or other things. So the corporate innovation should be there to make it possible to reach out, and it's possible to bridge the gap what the government can give and others can give, and managements will come in our way provided we show that we are also part of the CSR.
Excellent. Thank you so much.
Om Shri Sai Ram. I'd like just to share 3 of my experiences in this regard. The first thing is the way we dentists can help the medical fraternity in preventing diseases. I would just like to make a quote that mouth is the mirror of the body which reflects the systemic diseases. So majority of the systemic diseases has an early change in the mouth which we dentists can pick it up early and prevent further complications from coming up. So what I do in my unit is that I have a liaison with the physicians and the medical fraternity. Just like a routine blood check or a master checkup, every patient comes to the dental unit for a routine dental checkup. So there we are able to counsel the patient, educate the patient on good oral hygiene. So this removes the oral sepsis or the foci of infection. So systemic complications are prevented in this, and any early systemic diseases which we diagnose, we automatically refer it to the physician so that the disease progression is stopped. The second thing what I am doing at a micro level is, again, the problem which is bothering us is tobacco. Tobacco, which is usually in the 3rd or the 4th decade of life, has unfortunately now come on to the school children level also. +1, +2 students into smoking, into pan masala chewing, in spite of government banning it. The second alarming thing what's happening there in Chennai is that it's not only this tobacco among school children, but what you call as substance abuse, like cocaine, marijuana, ecstasy, freely available just outside the compound wall of a school. How we came to know about this is that a mother or a father walks in with a ward saying that my son was all right. He suddenly complains of a patch in the mouth or a burning sensation in the mouth. He is getting dull. So the moment I look at it, I know that this is not something abnormal, this is because of the habit. The children do not tell the parents that they are into these kind of habits. So what we do is that send the parents out, then the students confess it, but we don't inform the parents at that stage. So to overcome this, what we did, we went to the schools. We conducted camps, education. For that moment, it's effective. For 2 hours, 3 hours, 2 days, 3 days, the concept remains in the children's mind. But again, they go back to the thing. So what we have done is that instead of we teaching them, let's have their own peers to teach them. So we bring in the school pupil leader or their friends or their class leaders. So we bring them to our hospital, we teach them what are the side effects of this. So when they go and tell their peers, the acceptance rate is slightly better than a professional coming and teaching. The third thing what I feel we as dentists can be in prevention is that since I work in an academic institute, most of us are into teaching and we have postgraduate students with us. So at least for 3 years, a PG is going to obey whatever you say. He is not going to say anything against you. So this postgraduates, what I do for the past 2 years is that they have to do a dissertation or a thesis. And all PGs want to do a high level